Hey there, welcome back. This is video number 3, and in this video we're going to cover some warning signs after surgery and give you tips on what you can do. Really, we're covering common medical questions that people have and also discussing some uncommon problems that you might have and what you should do, when you should go to the emergency room, when you should call your doctor, and things you can do at home by yourself. Let's knock out the first question. Hey doc, what should I do if I have chest pain, significant problems breathing, or I'm too weak to stand? And the answer is simple. These are 3 major warning signs and you should go straight to the emergency room. Chest pain, significant problems breathing, or if you're too weak to even stand up. Go to the emergency room, they will take care of you and help figure out what's going on. Now for number 2 was, hey doc, my ostomy looks abnormal. And to cover this, the best way is to teach you what normal looks like, and then we'll show you what abnormal looks like. So what is normal color? Normal color is pink to a bright red, shiny look. And if I look at the images here, each one of these though, you notice the color is just a little bit different, but it still has that red, pinkish red color to it. And that means the ostomy is getting blood, it's alive, it's doing good. All right, now let's look at the skin around the ostomy. Here notice that it's a little discolored, but it's similar to the skin around it. Now on the bottom left, there is some redness there, and that is actually relatively typical. On the next slide, we'll show you what really red looks like. And the last one here is, how far does it stick out? Notice these all stick out by a different amount. All of these are typical, normal. On the bottom left here, we just have a little point. Small blood clots are normal. And here you can see just a little bit of blood. Now when I say small, what am I referring to? Like you can tap it with a tissue. If you see lots of blood coming through, that's something to be concerned about. And the blood that you see is more frequent right after surgery, but even afterward, if you're a little rough with it, you might see some of that. Small amounts are normal. All right, what does abnormal look like? Well, first, the color. Instead of being that nice red color that we had before, here we see that this is very extreme. This is a darkish to a blackish color. This means the ostomy is not getting the blood and therefore is likely dying. That's a medical emergency. The second one, the skin around it. Well, here, notice the difference. Not only is this extremely red, but in this case, it's actually spreading. And if you have this appearance of a spreading sunburn look on your skin, that's also an emergency and you need to let your doctor know as soon as possible. The third one, how far does it stick out? If it's sticking out too far, more than 2.5 inches, like we see here, that's called a prolapse. Number 1, number 2, medical emergencies. This third one can be managed a little bit more conservatively. And finally, if you have severe bleeding through your ostomy, that is not normal. And what we're referring to there is, more than you can dab with a tissue. And be conscious of, in your ostomy bag, a little bit of blood can make it look really, really red. So pay attention to what's actually coming out of the ostomy and if you're seeing lots of clots or blood coming through there. So what can you do if you're worried about your ostomy? Well, if you're ever concerned, feel free to call your doctor. Now, in the meantime, while you're waiting for your appointment, you can take a picture and see if it's getting better or worse with time. Take a picture each day. If you have that spreading sunburn look on your skin, you can take a pen and mark where it is red. And the next day, mark where it's red again. If it's getting bigger or getting smaller, that's a great way to tell. The fourth thing that you can do is you can continue to shower with regular soap and water. Not going to be a problem. And you might feel that a warm compress or a warm towel would provide a little bit of comfort. You can just put it on top of what's painful or aching. All right, the next question. Hey doc, I'm worried that I've got some nausea or some vomiting or some severe belly pain and it seems to be getting worse with time. What should I do? Now the best way to address this is really to start off by saying, when are you getting this nausea? If you notice you're getting the nausea after you take pain pills, well then it might be associated with those pain pills. And one solution for that is just to take it with a large glass of water or with a small meal. Now, let's say it's not associated with the pain pills. Then what should you do? Well, just move to foods that are simpler. And an easy way to remember simpler foods is what we call the brat diet. Bananas for B, rice for R, A for applesauce, and T for toast. Now if you do the brat diet and it's still not getting better, you still have nausea, or you still, let's say you're vomiting, you can try to move to sports drinks or just water. And if you vomit or you're still really nauseous with just fluids, then definitely call your doctor and let him know. And if you're having trouble getting a hold of your doctor, it's okay to go to the emergency room in that situation. Now, the last part here, we're going to give you a little scenario. And that scenario is, let's say you have a cramping sensation. It's somewhat painful, but you notice that your output has decreased significantly for 12 hours or more. Well, that can be signs of a blockage. And that is something to be concerned about. So definitely call your doctor. Try massaging the area. And if you massage around the ostomy, you might be able to dislodge or move that blockage. But if that pain stays there and it's getting worse with time, and it's severe pain, consider going to the emergency room in that scenario. Second to last, what if you're worried about fever? Well, first off, you don't have to take your temperature unless you feel sick or you feel warm. If your temperature is greater than 101, let your doctor know, and what you can do is take a Tylenol, over-the-counter medicine. Just follow the instructions on the back. Typically, they recommend not to go above 2 grams in one day. But if your fever is above 103, call your doctor and definitely consider going to the emergency room. All right, what if you're worried about your ileostomy output being too high or too low? Remember that normal is between 500 and 1500. And when should you let your doctor know what's going on? Well, if it's above 1500 for 2 days, right? 1500 per day for 2 days, then let your doctor know. Or if you notice that it's less than 500, and that's for 1 day, or if you have no gas for a 24-hour period, those are concerns that you might have maybe a blockage, and you definitely want to let your doctor know what's going on. If your ostomy output is really high, what should you do? Well, in the last lecture, or the last video, we talked about taking anti-diarrheal medicine. This is loperamide or Imodium, and you can take 1 to 2 off the bat, and then if you follow the instructions, it says take 1 pill every 4 to 6 hours while you still have loose stools. And for you, it's going to be a relative thing. So if you feel like it's more than normal, because all of your stools are going to be loose, but if you feel it's more than normal and your daily output is above that 1200 mark, then continue to take 1 every 4 to 6 hours. The other thing you can do is, if you don't want to take medicine, you can try foods which will thicken your stool. And some of those foods are actually part of that brat diet: the bananas, rice, applesauce, and toast. And in the next video, we'll also cover different foods that might be problematic and different food solutions. So stay tuned for the next video as well. All right, so that was our Big 5. And we did cover a lot there relatively quick. I won't be reviewing this time, but feel free to go back through 1 through 5 and read those up again. And remember, if you have doubts, just call your doctor. Totally all right. We're happy to hear from you. And we just want to make sure that you are happy and that you are safe.